cuts.
Nuh-uh. Technical help. Help! Push the help button.
How many medical students does it take? Turn on the microphone. How many do you need? Which microphone? Is it this one? Oh, that one's right. Okay. So let's try that again. If I'm talking and I'm also playing the piano, it's good? Good. Okay, good. Well, anyway, as I was saying, I'm just delighted to be a guest attending on the wards, because, I mean, this place really beats NBME headquarters. I mean, it's just an honor. I love having the responsibility to teach future medical students, and it makes me feel like I'm a steward of future generations. It's a responsibility that I take seriously, and boy, let me just tell you, I'm really, really looking forward to rounds today. Yeah, come on, students, and round with me. We've got so much to learn and so much to see, so that's why during rounds I'm going to pimp you aggressively. I deny you your vacations, and I cut off presentations, and I issue shitty evals. It's my form of recreation. Let's round. When you have to round, it can really drag your spirits up. All right, let's get my third year. Here, boy. Come, my friend. So, we have a patient that I'd like to introduce to you. This is a previously healthy 24-year-old left-handed woman who came here hypotensive with a fever in 104. There's purpura on her leg. And
Wait, she's actively seizing.
yeah, well, that makes sense, right? Given how high her fever is. And she probably she was seizing about 20 minutes ago. Are we going to do something? Let's not lose sight of what's important here. What I really think you ought to tell me right now is which prostaglandin is mediating this patient's fever. Is it A, prostaglandin A2? Is it B, prostaglandin B2? Is it C, prostaglandin D2, D, prostaglandin E2, F, prostaglandin B2, or is it G, prostaglandin I2?
Wait, who are you again?
Who am I? Yes, that is an interesting question, isn't it?
Poor Mel.
You do not know me. I'm the man behind the curtain. I think up questions whose answers are uncertain. When you learn you lack the stats to match to your favorite specialty, who's the man to blame? It's me! I steal your free time, I deny you from earning awards. Who am I? I'm the man who writes the questions for the boards. In my world, steroids are abused by every single teen. And every wedding serves a dish that contains fava beans. bases its curriculum on the questions that I write. So students, do not question me, because I'm always right. Now let's round. Oh, hello. You must be my medical student. No?
I think so.
Okay, so we have 46 cases to see in 60 minutes, so what's it going to be? Okay. Do you have a patient for me? Okay, is this the patient over here? I'll go talk to this patient here.
This wasn't one of my patients.
Okay, well, I guess I'll leave the show. What brings you here?
My chest is hurting.
Your chest is hurting.
Yeah.
Okay, so let me demonstrate. One key to being an excellent physician is asking the right questions. What do you like to do on the weekend?
Okay. Sometimes I play tennis, and a couple weeks ago I was caving. I went to a cave.
Oh, you went to the cave?
Yeah.
Say no more!
Yeah.
Histoplasmosis! But she has chest pain? Give her antifungals!
Okay. So our next patient is a 40-year-old African American woman who.
Say no more! Sarcoidosis! The answer! Boy!
But I didn't even tell you anything about her.
No. To the contrary, you told me everything I need to know. Yes, you're a nurse. I know what you're up to. You're coming to me because you want me to prescribe you thyroid hormone so you can inject it on the sly to lose weight. All of you do it.
No, but Doc, I just want to let you know, in case you didn't notice, you remember that chest pain patient earlier?
Quite well.
She died.
Of what?
Chest pain?
A heart attack.
This is tragic. I didn't know that histoplasmosis causes heart attack. If only we had given her the antifungal treatment she so desperately needed in time. This is a disgrace. I'm appalled. All right, team. Let's press ahead, though. We have many more cases to see. Woo! So, we're back. I would like to give a special thank to Yan, who lent us the piano, and also someone who isn't actually a medical student but is applying next year and offered to act. So. If you get him past to the interview round, he will nail the MMI. So what our class has done is we solicited embarrassing third-year stories from our classmates. And members of the MIRTH Patrol Committee are going to recreate these scenes drawn from each rotation. And I'm going to introduce each rotation with a song. So, your attention please, I call to order now this meeting of the Embarrassed Medical Students Anonymous. We'll start with the surgery rotation. Most days I wake up well before the sun's up. Most days and rounds I'm not off. Most days I scrub in, but it seems like such a hassle. I don't do anything, I just watch. To urinate, looks like I'll have to wait and just stand here for several hours more. What do I stand here for? I don't know, and I'm bored.
Hi, my name's Mindy, and I'm a third-year medical student.
Hi, Mindy.
So, I was pretty nervous about starting my surgery rotation. I mean, I'm really not surgeon material. So I asked one of my classmates who had done the rotation what I should do, not to honor, but just to not look like a fool in the OR. My friend was always complaining about how sore her arms were from retracting, or how she never got to tie any sutures, just got to cut the little ends off after the surgery. But she said the most important thing of all was to make sure I suck that smoke. I'm so confused. She said no. She did not misspeak. You suck it hard, you suck it long, you suck it good, and they will love you. So, I felt pretty prepared. I went in, and man, for a non-surgeon, I was awesome at sucking smoke. But we were in the middle of a case. I was doing my thing, sucking smoke like a badass. And the surgeon asked for suction. And I'm thinking, man, I'm already sucking the smoke. What more does he want? I'm not going to do that. So it turns out the patient was bleeding everywhere, like blood was gushing, and you can also suck blood. So he ripped the suction out of my hand and just shook his head at me, too disappointed to even speak a word. I guess I really did suck.
Next, the OB-GYN rotation.
Excuse me.
I have a guy with a short coat and a long logbook.
Hey everybody. My name is Cameron, and I'm a medical student. So I'm on OB, and everybody knows that guys on OB have the most fun. So I'm scrubbed in the OR, my patient's asleep, and I'm there to do the under anesthesia pelvic exam. There's got to be something wrong with my patient asleep and me. Well, I mean, it wouldn't be the first time I've. Anyway, so my attending and my resident look at me and they give me the okay with the traditional nod. And I begin. I don't necessarily have to ask the patient if she can feel my hand on her thigh. So I go through the exam, and I collect the sample, and I pull out the speculum. I set it down, and I'm ready to take the brush tip off to put into the little cup thing. And I'm taking it off, and this is where it gets interesting. Because in a few seconds, it's flying across the room, and it lands on the floor. So here's me thinking, shit. Did I just lose honors because that thing fell on the floor? So I know I'm going to get chewed out. I turn around. To my surprise, my attending and my resident are doubled over laughing. They found it hysterical, apparently. And then I learned the biggest lesson ever. We picked it up and sent it to Path anyway.
Hi, my name is Beth. Hi. So there I was. I've been with this lady all day long. Therapeutic for life. You're doing a great job. You're doing a great job. You're going to be such a good mom. You can do it.
Next, Pediatrics. In my 3rd year, I'm filled with angst. With each new block, I feel uncertain. If I don't get some good evals, my future plans will all be curtains. I never knew that on the wards they give us grades in a not so fair way. And so it's come to this. I do things
Hi, it's Beth again. Hi. I'm still embarrassed. So PEs is different. You know, our patients have special needs, but still when we go in and check on them in the morning, I always like to say, okay, is there anything else I can do for you? And this little boy said, yes, there is something. Someone needs to draw me a Santa Claus. I was like, okay, all right, I'm going to do that. So I drew him a Santa Claus, and I was like, is that okay? And he's like, no, you forgot something really important. Santa Claus has a beard!
Hi, I'm Mary. Hi, Mary. So I was on Peds, and we had this 3-year-old boy in Batman pajamas, and he had this rash. We didn't know what it was. Could be HSV, BZV, hand, foot, mouth. Whatever, it didn't matter, he was getting better. We were gonna send him home. And then one day I'm sitting there, you know, typing up my note, and his nurse finds me. She's like, you gotta come into his bathroom. She opens this diaper, and it's full of red poop. And I thought, this is my first rotation. I thought, is that what red currant jelly looks like? Oh my God, this kid got interception. Oh my God. We ran, we guayaced it. It was negative. Couldn't be right, we guayaced it again. Still negative. So we go and I get my resident. And, you know, he examines the kid, and besides, you know, the healing rash and still being a little itchy, the kid was fine. And then his mom walks in, and she pulls out of her bag this box of popsicles. Apparently, this kid was so irritable, she had been feeding him popsicles. Guess which one was his favorite color?
Hi, my name's Heidi, and I'm a 3rd-year medical student.
Hi, Heidi.
So, I'll be honest, I hated peds. I really hated peds. I hated peds so much that I walked into the wards to take care of my 5-year-old patient who was basically dying of an asthma exacerbation, and she looks at me and goes, little doctor, you need a sticker. She then proceeds to put a sticker on my white coat. I felt terrible.
Next is the primary care rotation. Hi, Dr. Ensign, Dr. Henderson. I actually don't have a funny song for this one. Pick it out when you will.
Hi, it's Mary again.
Hi, Mary.
So I was on my family rotation, and we had this 32-year-old woman who came in with symptoms of bacterial vaginosis. And so, collected the sample, did the wet mouth. And my priest doctor thought this was a great opportunity to show me how to do the whiff test. So he takes the glass slide, puts it up to his nose, only he put it up a little too close. And he snorted the sample
That was good. Hi everybody, my name's Richie.
Hi, Richie.
And I'm an embarrassed medical student. And I learned a very, very important lesson in family. So, first and foremost, there's something on my mind. I just can't remember the term. It's that thing that we all sat through, where we talked about our feelings.
I know. Cultural competency.
Yes! So cultural competency came to life for me on family. So I had this 65-year-old lady, super sweet, delirious beyond belief. And everyone knows delirium's a transient state of thought, right?
Yeah.
I didn't. So, I go in to talk to the patient. My resident says, this patient's a little delirious, just work with her and see what you can get from her history. And I'm like, okay, first rotation, awesome. And I go in, and she says hi to me in 3 different languages, none of which I spoke. So I'm thinking, okay, I learned through all the sessions we had to call for a translator, an interpreter, someone that can bail me out. None of them were available for any of the 3 languages she spoke. So I go over the phone. So you can always call for interpretive services. I dial the number, and they ask me, hi, where are you located? I said all the location information, my PIN, and all that stuff. And they ask, what language? And I'm like, can you tell me? So then I put the receiver to the person's phone, the patient's holding it, surprisingly, and starts to talk. And then all I can hear the interpreter say is, medical student, are you there? Hello? Why the heck are you giving me a patient where you don't know the language? So, in the end, I learned a few words of Portuguese, a few words of Spanish, and a few words of mom. How that happened, I don't know, but now I'm learning Korean.
Hello, my name is Claire.
Hi.
I'm an embarrassed medical student. So, to get to medical school, you have to take all these tough science courses. We got our year of physics, our year of chemistry, our year of bio. We learn the elegance of pharmacokinetics. And then we learn the graceful anatomy and all those crazy Latin words. So I get to 3rd year and I'm like, awesome. I finally get to show off all this totally awesome science that I learned. And then I get to family medicine. And my attending asked me to present on this Bristol stool scale. Has anyone ever heard of this before? Yeah, good. Okay, all right. All right, so you got the top here, you got your hard lumps, They're kind of like frozen peas. Look, this one's kind of like a pine cone. And this one looks like something your dog barked up. So really, what I've been trained for is to interact with 11-year-old boys.
Next, internal medicine. My friend asked if tonight I could catch a show. I had to tell him, sorry man, but I don't know. My workday isn't done until they let me go. And they don't let me go.